In today's practice, we're going to work through some deep core work. These exercises will help to protect the spine, so they'll be strengthening through the core and the low back, but at the same time, we're going to be avoiding some of the traditional core exercises that can actually be more risky when it comes to back pain. Let's begin in a tabletop position today. So finding this position where your wrists are positioned underneath the shoulders and your hips are stacking right on top of the knees. From this position, we'll start by finding a little bit of that core activation. So from where you are, just allow your belly to hang here. So no work happening, the belly dropping toward the floor, and notice what that feels like. And then from here, start to draw the belly button in toward the spine. So you're lifting the belly away from the floor. Notice as you do that, not only does it activate the front of the abdomen, but you'll feel this cinching sensation on the side waist and into the low back as well. So we're activating the deepest core muscle here. This is called transverse abdominis. This muscle wraps around the low back and across the abdomen, creating a corset-like action. And we're going to move this a little bit with breath so that we can really find the activation of this muscle. So start to allow the muscle to relax once again. This is going to be your inhale breath. Imagine that you're filling the belly with breath. And then as you exhale, we're drawing that belly toward the spine, cinching up through the side waist, pressing the air out of the abdomen. Inhale like you have that balloon in the belly. We're breathing in as the belly expands toward the floor. As you exhale, like the air is being released from that balloon, everything starts to shrink into that abdominal space. Another inhale as you breathe in, expanding through side waist, low back, abdomen. And exhale to engage through that corset. From here, we're going to find maybe a 50% activation here. So some activation still happening, but we're able to breathe comfortably. We're going to maintain that activation as we start to move the spine. Coming into cat-cow. So as you inhale, the head lifts and the tailbone lifts. As you exhale, rounding through the spine, dropping the head toward the wall behind you. Inhale, opening up through the front body, shoulder blades slide together. Exhale, rounding through back body, shoulder blades slide apart. Couple more breaths like this. Inhale as you lift that tailbone. Exhale, tipping pelvis down toward the floor. For one more breath here, inhale. And exhale. Your next inhale brings you more to a neutral tabletop position. So we have the gaze in between the hands, keeping some length at the back of the neck. We'll move into an exercise called bird dog. So from this position, begin to extend your right leg behind you. Now in this place, you may still have the toes on the ground here. They can be hovering off of the mat. The height of that back leg is less important, but we want to make sure that the pelvis stays level. The tendency here is for the hips to want to roll open to be able to lift the leg, but we can check and make sure this isn't happening by taking a peek down at the toes and ensuring that they're pointing toward the floor. And this might be where you stay. You may also choose to extend the left arm out in front of you, creating a fist with the hand and reaching that arm forward. So rather than thinking about lifting the arm and the leg, can you think about pushing your foot toward the wall behind you and pressing the fist forward so you feel this whole lengthening through the body. Keeping the torso level and of course continuing with the breath. Take one more inhale here. On the exhale, release the arm if you have it lifted, release the leg down. Let's do a little cat-cow here in between sides. Inhale to lift the head and the tailbone. Exhale, rounding through the spine. Your next inhale brings you back to your neutral position. We'll do that same thing on the other side. So this time, left leg extends behind you. Perhaps the toes stay down on the floor here. You may also choose to start to hover them or lift the leg higher. We want to ensure that the pelvis stays level. And then either choosing to stay here or extending your right arm out in front of you this time. Once you have your alignment again, bringing the neck in line with the rest of the spine. So gaze should be down on the floor. Breathing through this positioning, keeping that core engagement. Take one more inhale breath here. And on the exhale, release. Another inhale for that cat-cow, lifting head, lifting tailbone. Exhale, rounding through the spine. Coming back to that tabletop position from here, start to slide your knees back now. So we're lengthening out this stance. These shoulders still stay stacking on top of the wrists, but now we have the head in line with the tailbone, in line with the knees. So creating this long line, this kneeling plank. And again, we're finding a little bit of bracing on that abdomen. So some engagement through the core here. We want to maintain a neutral lumbar spine, so we don't want it to be arching too much. Keep thinking about pressing the tailbone down toward the floor. And we're going to move this a little bit to get some mobility through the spinal column. On your next exhale, we're going to slide back into a child's pose. Your inhale will roll the body forward back to this kneeling plank. Exhale to slide it back, child's pose. Inhale, rolling the body forward to your plank. Last time like this, exhale to slide it back. And inhale, bring the body forward and pause here in this kneeling plank. Taking a few breaths here. We're not dipping down into the shoulder girdle here, so again, keeping some strength in the arms, pushing into the hands as if you're pressing the floor away from you. And from here, we'll slowly lower down all the way to the floor. So for a count of 5, 4, 3, 2, and 1. Coming all the way down, we're going to keep those arms just as they are here. Maybe you walk your feet back a touch so that you're creating more space at the front of the hips, setting up for Cobra Pose. So in this posture, we're going to keep the legs rooted to the earth here. You're pressing the tops of the feet down into the floor, and it's just the head and the chest that are going to be lifting. So we're using the strength of our extensor muscles that run along either side of the spinal column. And we'll move this with breath. So as you inhale, we're lifting the head, we're lifting up the chest here. As you exhale, rolling back down to the floor. Another breath like that. Inhale to roll up. Exhale to release. And one more breath like this. Inhale to lift. And exhale to lower. Turning onto your side, let's set up for a modified side plank here. So we're going to position ourselves so that the elbow is right underneath the shoulder. The forearm is parallel with the top edge of the mat. And we're going to keep a bend into the knees here. We'll be lifting up from the knees. So from this position, start to think about lifting that top hip up toward the ceiling. We don't want to rotate the pelvis forward or back here, so we're keeping the legs stacked. And what you'll notice is that it's the underside of the abdominal wall that's working here. So the side that's closest to the ground, those oblique muscles, doing the work to lift you. Your hand can stay on the hip, or we can reach the fingertips up toward the ceiling. We're going to stay here for one more breath in. And on the exhale, slowly release. Moving through center, let's roll on to the other side. So this time we have the opposite arm positioned underneath. Again, forearm is parallel with the top edge of the mat. Knees are bent. Keeping the pelvis neutral, so not rotating the pubic bone up toward the ceiling or down toward the floor. We start to lift up through the hips, engaging that underside oblique. Find your stability here. And then your hand stays on the hip, or we can reach fingertips up toward the ceiling. Taking one more breath in. And on the exhale, release. Coming back through center, let's come back onto that first side one more time each side. Option this time if you'd like to extend the leg. So if you're doing the leg extension, we're going to place the top leg in front. So it'll be the inside edge of that foot that's resting on the floor. Your back foot, it will be the outside edge of the foot resting down. This is a split stance. It creates a little bit more stability here, less chance for the pelvis to roll. Once again, we prop ourselves up onto the forearm. Your option is to continue working from the knees like we did in the first round if you wanted to do that. And then again, hand can stay on the hip, or we can reach fingertips up toward the ceiling. Taking one more breath in here. On the exhale, release. Moving through center, rolling to the other side. Setting yourself up, making sure that your shoulder is right on top of the elbow. We're stacking those joints. That's the safest way to keep the body here if we're putting it under some stress. Split stance. So top foot comes in front. We're on the inside edge of that front foot. We're on the outside edge of the back foot, lifting up through the hips, keeping hand on the hip or reaching fingertips up toward the ceiling. Take one more inhale breath here. And exhale, slowly release. This time we're going to turn onto the back. So coming to rest on your back, centering yourself on the mat here. Let's just take a couple breaths. Take your feet about mat distance apart. Allow your knees to rest in toward one another. Place the hands on the belly here. As you inhale, feel the belly moving into the finger pads. As you exhale, feeling the belly button dropping toward the spine, letting that air go. Take one more breath like this. Inhale. And exhale. Now from this position, we're going to feel the difference here between abdominal hollowing versus abdominal bracing. I find that this is easiest to feel if we're lying on our back with this relationship to gravity. So first for hollowing, we're going to think about creating sort of a bowl in the belly area on the exhale. So when you breathe out, it's almost like you're sucking in the belly, you're flaring out the lower ribs. We're creating what would look like a soup bowl in the abdominal space. So let's try that. As you inhale, you feel the finger pads press into the belly. And as you exhale, we're sucking the belly in toward the spine. We're flaring out those lower ribs. Let's do one more breath like that. Inhale to expand belly. You feel it pressing into finger pads. Exhale to hollow out the abdomen, flaring out lower ribs. Well, let's release that here. So that's not the action that we want to be using when we're trying to brace the core. That's actually not the one that's going to create the most stability for us. We're going to do some bracing this time instead. So place your fingertips on the lowest part of the rib cage at the front here. We're kind of in that space between rib cage and pelvis. And then this time, as you inhale, the action is still similar. So you'll feel belly pressing into finger pads, belly expands. But this time as you exhale, think about pushing the edges of the belly into the finger pads. So it's as if you're bracing for impact here. We're pressing the belly out to brace as opposed to trying to pull the belly in. Take another inhale breath here. And as you exhale, once again, letting all the air go and pushing the abdominal muscles into the finger pads, creating more stability around the core. We're going to use that for our next exercise here, coming into a modified curl up. We want to use that bracing action of the core. So let's extend the left leg, but keep the right leg bent. Slide your hands into that space behind your low back. And then from here, instead of lifting all the way up into that sit-up, which is going to put a little bit too much stress on the low back here into the lumbar spine, we're just going to lift up the head and maybe the shoulders. So keeping that nose pointing up toward the ceiling, maybe just lifting an inch or two off of the floor, finding that abdominal brace. We're not holding the breath. Keep it slow and steady. Take one more inhale breath here. And as you exhale, slowly release. Extend your right leg this time. Bend your left leg, foot planted on the mat. Same thing here. Take an inhale breath where you are. And as you exhale, slowly lift up, finding that abdominal brace. We hold the brace, but we don't hold the breath. Take an inhale breath here. And exhale, slowly release. From here, let's release the hands out of the space behind the low back. Reach fingertips up to the ceiling this time and bring your legs up. So now your knees are stacking on top of your hips. Your shins are parallel with the floor. It's creating a shape as if you're sitting into a chair. From here, we'll take an inhale breath where you are. As you exhale, we're going to tap down the right toes here toward the ground, keeping that spine and pelvis neutral. Your inhale lifts the leg back up to the starting position. Exhale, left toes tap down this time. Inhale to lift. Exhale, right toes tap. Inhale, lift. Exhale, left toes tap. Now you can keep moving like this, or I'm going to show you a couple of other options. As you extend that right leg, maybe this time you lengthen it out so it's hovering off of the mat. Your inhale brings that leg back to center. Exhale, extend the left leg, maybe hovering off of the mat. Inhale, back to center. You may keep moving like this, or we incorporate the arm on the exhale, opposite arm to leg, extending overhead. Inhale brings you back to center. Exhale, opposite arm to leg extension. Let's do one more on each side. Inhale takes you back to center. Exhale, arm and leg extend. Last time, inhale to center. And exhale, arm and leg extend. Coming back to center here. Release both feet down onto the floor. Bring your arms alongside the body. We're going to get set up for an active bridge here first. We're going to close our practice today with a supported bridge. So if you have a bolster or a block or some other prop at home that you can slide underneath the pelvis in this pose, that will feel really nice as a way to stretch out the front of the hips and the abdomen. We'll start with the active bridge first though, pressing palms into the floor. We're going to inhale as you lift up through the pelvis, through the low back, pushing into those feet. As you exhale, release one segment of your spine at a time as you come down to the floor. Another inhale here to lift up. Exhale to release. And last time, inhale to lift. And exhale to lower. Using that prop, if you have it now, we'll slide the prop underneath the pelvis. So if you have this too high up on the low back, it will create a fulcrum and your tailbone will want to dip down toward the floor. So we want to make sure that we have the prop low enough underneath the pelvis that it's supporting the weight of the glutes. You feel like you don't have to hold your body weight here. And then once you have found this position, can you let go of the holding in the abdomen? As you let go of that muscular effort, because we have the pelvis positioned above the heart, you may notice this gentle pull and tug of the digestive and reproductive organs as they shift upward slightly. Feeling that stretch deep in the pelvis and the front of the abdomen, we can increase that sensation by using the breath. So as you inhale, you're stretching out the front body, taking a big belly breath in. And as you exhale, what can you soften? What can you let go of here with the out breath? For your last few breaths, you may stay exactly as you are. For a bit deeper stretch for the hip flexors, we can also extend the legs out. I suggest if you are using a block that you place it down onto one of the lower heights here so that it's a little bit more stable. Extending those legs out, allowing the toes to fall away from one another, and just enjoying this stretch and opening through the groin, through the front of the pelvis, the hips. Let's take 2 more breaths here. From here, if you have your legs extended, walking those feet back in, push into the feet just enough that you can lift the prop out from underneath you, resting down here onto the back. And then taking your time, however it makes sense for you, making your way up toward a seated position to close our practice today. Finding your most comfortable seat, your hands can come to heart center or any other place where you feel this deep connection to yourself. I hope that this practice was helpful for you today as we worked through engaging the core muscles to protect the back. I look forward to seeing you next time. Namaste.